Why are colonoscopies so important? Find out on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello and welcome to Digest This. I'm Dr. Liz Cruz and I have the beautiful Tina Nunziato sitting right here by my side. Thank you so much for joining us. If you are a first-time listener, welcome. And we are so happy that you're taking the time to hang out with us. And if you're a regular listener, we love you and we appreciate your loyalty to this podcast.
I just realized I'm wearing a red shirt and you're wearing a red hat today.
Oh,
We're like matching.
that's right. That was not purposely done. But who knows?
Right.
Maybe. So here we are.
Here we are talking about colonoscopies again.
That's right. Talking about colonoscopies.
We can never talk enough about colonoscopies. Can I just say that?
Yeah, well,
Oh, my goodness.
it's part of what we do, right?
That's right.
Every day in, day out. Well, except on the weekends. Except on the weekends. Yeah, we wanted to talk about the importance of colonoscopy, but we're going to back up a little bit. Why are we bringing this topic up? People continue to die of colon cancer. Because of colon cancer. That's right.
Yes.
Is that dramatic enough?
That was dramatic.
Da, 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 da. People continue to die
Needlessly.
because
can
of
we just
colon
say.
cancer. Why? Why? When we have such a great tool available on the tips of our hands to do an exam of the colon and to look for polyps, to look for abnormalities, and to prevent colon cancer. It continues to break my heart anytime I find a tumor in someone, because I honestly feel that we shouldn't be finding tumors in the colon anymore, because we've been doing, colonoscopy has been the standard of care since 2000. And, so we're going on over 2 decades that colonoscopy has been the standard of care. And yet I continue to see patients that are maybe in their 50s, patients even in their 60s, okay, that have never had a colonoscopy, who were never told until just recently, hey, you need a colonoscopy. So there are a lot of factors, I think, that play into it. Obviously there's also people that know about a colonoscopy that don't want to get a colonoscopy.
Well, I talked to one of them this week.
Yeah?
Actually. Yeah, I had a consult with a woman who was about 58 years old, had never had a screening colonoscopy, and she's been having digestive issues. And I said to her, "What are you waiting for?" And she's like, "Well, I'm scared. I've heard the horror stories that some people die." And I'm thinking to myself, is like one horror story out there that the same horror story that everyone's listening to? Because, I do the math. You do about 3,000 colonoscopies a year. You've been doing this for, how many years? You very rarely have a complication, much less a death, right? And so it's crazy that people cling on to their fear of, you could die. Yes. Could you die? Yes. Is it likely?
Yes.
No. And to hold on to that fear and then have the repercussion of potentially having cancer, like, you've got to really weigh that. Right?
You could also have that risk of dying in a car wreck.
Right.
Okay?
Exactly.
And we all drive. The majority of us drives. Okay? And we're driving every day. I remember going to a driver's ed class, and I remember the person that was teaching telling us that driving cars is probably one of the most dangerous things we do every day. Okay? Every day. No matter how careful you are. And I, when I'm in the surgical center, in the pre-op, talking to patients before we take them back, I always go over the risk. And I tell them, look, for the most part, patients do great, and it's considered a safe exam. Okay? Are there risks? Yes. There's risk with the anesthesia. There's risk of bleeding, risk of perforations, risk of infection, all of which could require emergent surgery, all of which could be a severe complication and yes, could lead to death. That is so rare, so rare. And then sometimes if I have somebody where as I'm telling them this, their eyes are getting big and they start asking me questions, I talk with them and I tell them, look, you drive a car. Do you drive every day? Yes. Every time you go out there, you are at risk also for having an accident. No matter how careful you are, okay?
Because you can't control everything
you
around
can't control everything around you, okay? So, we've had some people that, and I'm sure there's many, many more that we don't know about, but specifically just recently, Kirstie Alley died. She was 71 years old. She died of colon cancer. And she, we don't know the details of what happened with her. All I've heard or all I've seen when I looked up on the internet was that she got diagnosed and then very quickly died.
Right.
Okay, so
typically, that means that they found a pretty extensive
something pretty
cancer
advanced.
At that point. Yeah.
Yes.
Where you would assume that she probably maybe had never had a colonoscopy or maybe had one a really long time ago and never had another one and she should have. Because typically you're not going to, be diagnosed and die, that quickly from having a traditional, colonoscopy.
Exactly. So she was 71. There's the story of another young person, Randy Gonzalez, who I guess he and his son became huge TikTok sensations. Celebrities. And actually, you probably know more about that.
Yeah, no, the staff at our office brought him up to me about 10 months ago or so. They sent me a link to a news story that was done on him. He and his son are known as the Inky Boys on TikTok, and so I was watching the news story then, and they were just talking about how the young guy at the time, I think 34, 35 years old, because he just recently died.
Okay.
I think it was like 10 months after he was diagnosed, but he had been having abdominal pain for years and never went and had it looked at. And then he was just so sick of the abdominal pain, he decided, okay, I'm going to go have a colonoscopy, and they find stage 4 colon cancer. And he was at the time 34 years old. So, here's the thing.
Wow.
GIs are finding cancer in 20-year-olds. You cannot assume that because you're 20, 21, 22 years old and having abdominal pain, it's nothing.
Yeah.
Right? You have to get checked. Like if you are having recurring abdominal pain, you are having blood in the stool, you are having irregular bowels,
change in bowel habits, weight loss, whatever, any of that.
You have to get a colonoscopy.
Yes.
It's not an option. It is such an easy test to do to see what's going on in there, and it's such a preventable test. To prevent
preventable cancer.
It's such a preventable cancer, right?
Absolutely.
If you get it checked and you get it taken care of, even if you find a tumor,
right,
you could have that portion of your colon removed and live the rest of your life.
Exactly.
Right?
Exactly.
In a normal way. So,
and we've had a lot of young people that we've done colonoscopies on. And I'm talking about anywhere. I would say that the youngest person where I have found precancerous polyps was 18 years old.
Wow.
18 years old, okay?
So if that 18-year-old waited till even they're 45, which is the new date,
probably wouldn't have made it.
Not going to make it.
He wasn't even going to make it to 45, okay? So we're finding more and more precancerous polyps in younger people, and sadly, cancer, colorectal cancer. We're finding it in younger people, which is why they lowered the age. The American Cancer Society came out with a recommendation. It used to be the age 50 for, colonoscopy, to start having a screening colonoscopy, unless there's family history. That could change the recommendations. But just in general, with average risk, it was 50. I believe it was 2018. In 2018, the American Cancer Society changed it to age 45. And the gastroenterology societies agreed but did not fully endorse it until just recently. So it's been already a few years that that recommendation was made, and I actually we started doing screening colonoscopies on people that were 45.
Yes, I'm one of them. I was waiting until 50, and as soon as the 45 came out, this one was like, nope, you gotta go. And I'm
That's
like,
right.
but no, I eat healthy, and I don't have any issues, and I'm fine, and nope, go get it done. Okay,
Yep.
I went and had it done. 48 years old. So look, it's not hard. Okay, I mean, even the prep, like before I had my colonoscopy, I'd always tell patients, oh, the prep is the worst part. The prep is the worst part. You got to drink the stuff and you're pooping all night. But even that wasn't that bad, honestly. Like, okay, sit on the toilet, poop all night. It's not terrible to get your colon looked at and have polyps taken out, okay?
I always say better to suffer with pooping all night than to suffer with a diagnosis of colon cancer, which now takes you down a totally different pathway. Hopefully, if it's not advanced, because if it has already spread to the liver or even to the lungs, I mean, that's where you start getting into a poor prognosis. But fortunately, and thank God, most of the colon cancer that I have found in the last few years have not been advanced. And those patients are still alive and doing great and have done well with whatever treatment they got. And I'm still seeing them for their follow-up colonoscopies.
It's such a preventable thing. Even if you do find
Yep.
something early stages, like I said, you can have that removed and you can live a normal life. But
Absolutely.
you got to get checked and you got to get it out of your body. You know?
Absolutely.
And ever since Randy Gonzalez died, the staff at our office has been like, oh my gosh, we all need a colonoscopy. you know? And,
Yeah.
And I was like, okay, well, if you're still in your mid-30s and you're not having digestive issues, you're probably okay. But we do have a couple staff. They're like, well, I've had digestive issues. Then get a colonoscopy. Like, what are you waiting
Well,
for?
and we see a lot of patients that come in who are having abdominal pain throughout their abdomen or lower abdominal pain or upper, and maybe they've had a little rectal bleeding on toilet paper, but not in the stool. I'm going to tell you something. Those patients are going to be offered a colonoscopy, okay? And if they're having upper abdominal pain, they're also going to be offered an upper endoscopy, because I've seen way too much already to not offer these patients these exams, okay? I mean, I've had patients who have come and told me, I had one patient several years ago who had been to several doctors and had been told that the rectal bleeding she was having was from hemorrhoids. And she got treated. They were treating her hemorrhoids, but for whatever reason, nobody ever did a colonoscopy. I don't know if it was because she was young, and my assumption is because she was young, they were basically attributing the rectal bleeding to hemorrhoids, and they were treating her hemorrhoids. However, then she started to experience anal pain. And then by the time she got to me, her anal pain was quite severe. And when I got in there, she had an anal cancer. Okay. And so, I ended up sending her to a rectal surgeon. I did the colonoscopy, found the anal cancer. She went and got treatment. But that's a perfect example of why I continue, and this is how I've taught my nurse practitioners, and I have been criticized in the past. Well, they just had some little bit of rectal bleeding. Why did you do a colonoscopy on them? You know why? Because I've seen stuff. I've seen rectal cancers. I've seen anal cancers in young people. And so if you come to us and you're having any rectal bleeding, you're getting a colonoscopy.
Why not?
If you're having abdominal pain, we're gonna offer you procedures, okay?
This procedure takes less than 30 minutes.
Our
It's
goal
like,
is to
why
rule
not?
out the bad
Yes.
stuff.
That's the whole reason why people come to a GI. Why would you not offer them a procedure? That's why they're going to see a GI, is to get that workup to make sure there's nothing really bad going on.
Right.
That's the whole point.
So look, don't be afraid. I mean, yes, I know it's natural to have some anxiety about it, but look, these tests, the colonoscopy is a preventive exam. All right, don't get to the point where now you've developed anemia, you're losing weight, you're seeing some blood in the stool. I mean, look, that's not good, okay? And it's possible that if you wait to that point, that it could be too late. And we don't ever want to get to that point. And by the same token, I just want to say one more thing on screening colonoscopies, because through the years I've had many patients say, why do I need to have this? I feel great. I'm like, that's perfect. This is when we want to catch you so that we can get in there. Polyps are not going to cause symptoms. We want to get in there. If you have polyps, we want to get them out of there, because if you get to the point where now you're having issues, that's not good. That could be too late, okay? And we don't ever want it to be where it's too late. Not when we have a test that could prevent colon cancer. All right? All right. Well,
yeah,
I think
that was a lot.
Yeah, that was a lot. But thank you for listening. And if you have any questions or you want to connect with us, please check us out. Go to our website, drlizcruz.com. And you can connect with us. You can schedule a free 30-minute wellness consult by clicking the magenta button on the home page. And if you haven't subscribed to this podcast, what are you waiting for? Subscribe so that you don't ever miss an episode. And lastly, if you haven't given us a rating, please give us a rating, and please give us a 5, because it'll help other people just like you to find us easier. Thank you so much for joining us and for being on this journey with us, and we'll catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.